Hello everyone, I'm Bria, and today I plan on talking to you about never events. What is a never event, you ask? Let's just answer that by asking another question. How would you feel if you went into a right total knee surgery and came out with a left total knee? So let's define some terms. Never event is an error that is catastrophic and easily preventable for patients. A sentinel event is an unexpected occurrence involving death or serious physiological or psychological injury or risk thereof. The Joint Commission, which accredits and certifies thousands of healthcare organizations and programs in the United States, uses these two terms interchangeably. Today, I will use the term never event. Let's talk more about never events. Never events have 7 different categories. These categories include surgical or invasive procedure, product or devices, patient protection, care management, potential criminal, radiologic, and environmental. And within these categories, there's 29 subcategories. Some examples of these include operating on the wrong site or wrong person, use or function of a device in patient care that is not used for the intended purpose, patient suicide, attempted suicide, self-harm that results in a serious injury while being cared for in the healthcare setting, and patient death or serious injury associated with a fall while in the healthcare setting. A healthcare setting could be any of the following: hospital, outpatient, or office-based surgery centers, long-term care, or skilled nursing facilities. Yes, we laugh at this cartoon. However, never events can be very devastating to a patient and their family. In the United States, never events are quite rare, with roughly 1 case per hospital every 5 to 10 years. Overall, though, there is an estimated 4,000 surgical never events that occur every year. This leads to an estimated $1.3 billion over the past 20 years due to never events. Let's put this into perspective. The Joint Commission reported in 2009 that the most common never event was a wrong site surgery at 13.5%. That is crazy. Now, what has healthcare done to prevent this, you ask? Medicare and Medicaid have stopped reimbursing hospitals and physicians for any care related to these never events, which is a pretty big step because many of the other insurance companies have started to follow suit. So we have talked about what never events are and how healthcare and insurance companies are helping to prevent this. But let's talk about how us, the physical therapists, are affected by this. The first example of a never event that could occur in physical therapy is the death or serious injury to a patient or staff member associated with an electrical shock in the course of a patient care process in a healthcare setting. In our profession, we have the option to use modalities as a treatment for our patients. One modality that this could occur with is the use of electrical stimulation, or E-stim. We can prevent this never event of shocking our patients by using the correct parameters. Another never event is the death or serious injury associated with a burn incurred from any source in the course of a patient care process in a healthcare setting. Burns could happen in the field of physical therapy with the use of hot packs. In 2016 alone, 61% of lawsuits against physical therapists were due to burns and lack of patient monitoring. As physical therapists, we can prevent this from happening by having at least 6 to 8 layers between the hot pack and the skin and being attentive to our patients. Death or serious injury by medication errors. Another never event that could happen in our field. As physical therapists, we are not allowed to prescribe medication, which means we should not be suggesting to our patients to take ibuprofen or other anti-inflammatories because they should be asking their physician about it. Unfortunately, there are therapists out there that still suggest medications and can lead to problems for the patient down the road. The next never event example is pressure ulcers. Pressure ulcers are never great, and definitely not when a patient forms a stage 3, 4, or even an unstageable pressure ulcer after the admittance or presentation to a healthcare setting. On the screen, you can see the difference between the different stages of pressure ulcers. A stage 3 goes through almost all of the soft tissue, and a stage 4 goes all the way down to the bone. As physical therapists, we need to make sure we help the patient in positioning and getting the patient up and moving. The final never event that we're going to talk about is falls. No one likes the fall. The patient, the physical therapist, and the rest of the healthcare team. Unfortunately, as people get older, they are at an increased risk for falls. As physical therapists, we can help decrease the amount of falls by using gait belts when a patient is up and walking or doing balance exercises. We want to do balance exercises to help increase the patient's confidence. A big way we can help our patients is by educating them on falls by telling them what not to do when they fall and how to decrease their risk. So that was just a few examples of how never events relate to physical therapy. There are still so many other examples out there, but you just need to take the time to look. Bottom line, be aware and help others become aware of what never events are. We also do not want to forget to educate our patients. So today we talked about never events. To review, never events are catastrophic but preventable events that happen to patients in a healthcare setting. Then we talked about how insurance companies are preventing them. Finally, we talked about some examples of how never events can occur in the field of physical therapy. Remember, the best way to prevent a never event is to be aware of them. On the screen, you have a list of further resources to find out more about never events. The full list of never events can be found on the National Quality Forum's website that is colored in red. That is all today, and thanks for learning about never events with me.